Hey friends, Dr. Christy here, and I want to talk to you about vitamin D for a second. I had a patient this morning who told me that her medical doctor told her when they got their vitamin D level tested in the blood that their level was pretty reasonable. They may want to supplement just a little bit. Their level was 26, and anyone in the optimal health functional medicine world would tell you that that's way too low. Not only is 26 level of vitamin D in the blood lower than the standard medical range that's on the blood work, but it's way outside the optimal range. In my perspective, a minimum level of 50 or even 60 is best for optimal function. This is talking about hormonal function. We're talking about immune system. We're talking about your mood and your energy levels. Vitamin D acts more like a hormone in your body than it does a vitamin. It's critical in so many body processes. And I'm in Chicago. I'm not getting much, based on the latitude that we are at in the earth, we will not be getting much vitamin D exposure from the sun any longer until we hit probably April of next year. So really check your vitamin D levels in your blood. If you do not take vitamin D, you at least got to find a way to get it somehow. If you travel to tropical areas, you can get more sunlight. It's just very critical. If your levels are under 30, I highly recommend 10,000 units a day for most individuals when your levels are under 30 for at least 3 or 4 weeks to get them up. And then you can stabilize at about a 5,000 units per day dose, which is kind of a good maintenance dose. Maybe it'll increase you a little bit over that time. People who tend to get a little bit concerned about overdosing on vitamin D, I have rarely seen anyone get their levels high enough that it could be toxic. And even in the few people that I've seen that where their levels have gone over 100, they've had 0 symptoms of vitamin D toxicity. So we look at their blood work and say, well, I'm great. I'm glad that you're feeling so good. You maybe can back off on your supplementation now. And it's as simple as that. Oftentimes we get so worried about over supplementing and we get fearful that we're going to get hyper vitamin D situation where it's toxic in the blood so much that we don't end up getting enough, and that's just as problematic, and actually more problematic in my opinion. So get your D levels checked. If you have any other questions, drop them below. I'm always here to help, and I hope you have a good day.